our lifetime, shall we see perhaps a catastrophe like the COVID-19 pandemic? A pandemic that left thousands of citizens dead. A pandemic that put our ailing healthcare system into a chokehold. A pandemic that left millions without jobs and others furloughed. A pandemic that brought the education sector into a shuddering halt. A pandemic that left families indebted to hospitals and Shylocks. But when government was expected to enforce physical discipline, austerity measures, and prioritize key sectors, it chose to spend billions of shillings on cars to lavish politicians and highest paid civil servants.
At a younger age, I had never enjoyed our life like any youth had enjoyed their lives. We had suffered since the time she left school up to the time she passed on.
Dunstan Kasango and his father, Willie Tigalia, bow their heads to escape the sunrise of a blue sky as the colors from the scorching sun bore in reference to their grief. It's been nearly 3 months since they buried Angel Nakasango. 29-year-old Nakasango passed on outside Kampala Hospital in an ambulance as the family desperately tried to search for money to pay for her treatment.
Then we did have 4 M in cash. We went to Mulago. We found the Mulago was too full. Yeah, Mulago was too full. Then they told us to go to Nambole. And transport, like, there was no, they could look down, the cars were not moving. We had to look for a way how we could buy an ambulance take here. The ambulances were expensive. We left. I saw the situation was getting worse. We went to Kampala Hospital. We hired an ambulance to go to Kampala Hospital.
How was it easy to get an ambulance?
We reached Kampala Hospital. They looked at us like for 30 minutes. Angel is in an ambulance. She can't breathe. She's on oxygen. Full thing was the doctors not to bother like for 30 minutes. Yeah, they saw us in an ambulance and they couldn't bother like to support us.
A young life cut short. Nakasango had a charming character, dreamt of working in the tourism and hospitality industry.
Fortunately, she didn't even practice. She didn't even got any chance to practice what she was chasing in her life.
Her family believes Nakasango would not have died if the country had affordable and adequate health services.
I expected her to take care of me. Now I'm 68 years. I'm not getting this money from the government. I have no job. Better than sending more money in the cars for paying the MPs. Yet they are getting their salary, monthly salary. Why should you put money in buying cars? 2 million.
The predicament of Nakasango's family is similar to thousands of handicapped families that struggled to pay bills as the second wave precipitated by the Delta strain tested Uganda's ailing health sector and exposed its chink in the armor. Blaring horns rang out as ambulances crisscrossed roads in search of oxygen and scarce intensive care unit beds. Many patients died before rescue could come their way. Those who survived have been blighted by the long-term side effects of the disease, which include trauma and depression. Other families remain indebted to private hospitals and are on the verge of bankruptcy. The national response towards combating the deadly pandemic received plaudits in its early days when COVID-19 struck in March 2020. However, the country couldn't afford to sit on its laurels. Alarm bells were sounded about an impending second wave that could be lethal and place the healthcare system under strain. Yet government did not adequately equip hospitals. At the country's hour of reckoning, it became evident that those in charge lashed from one crisis to another.
We didn't get here by mistake. We got here almost by design. We've mismanaged so much, we've mismanaged so many things that when the pandemic required us to manage that one thing, there was no chance that we were going to manage it properly. We had a very long history of mismanagement.
so, did the second wave teach us any lessons?
And it's been a bumpy road. And as a citizen, I was thinking something we learn from, because sometimes problems come, but they're meant for you to learn. How can you plan better? Probably you did not know how to reshape yourselves.
In July, and as the numbers of those critically ill and hospitalized began receding, government spent nearly 106 billion shillings to buy lawmakers brand new vehicles. The cost provoked a debate and criticism from the public, who felt that for a poor country facing a health crisis for such monumental proportions, they should have prioritized the health of its citizens.
You know, some of the best paid employees, members of parliament, should manage their own transport. There is no reason whatsoever a taxpayer should be fussy about what vehicle the member of parliament needs to drive. You know, so I'm a surgeon. Shouldn't the country be concerned about what cars surgeons drive? But is anybody buying surgeons' cars? No. They pay them what they pay them, and they expect them to find their own transportation. What is wrong with legislators finding their own transportation? Why do we need to buy them cars at all?
You see, our proposal number one was that this financial year, nobody should buy a car. No transport equipment should be bought except for security and health. So these new ministers who are claiming they want new carpets, they want new chairs in their offices, new curtains, new vehicles. These are things we could have postponed.
For me, I think it's the issue of timing, you know. It's okay to buy for someone a vehicle because it facilitates the activities, because this is the style of Uganda. You know, it's not in every country that MPs have bought vehicles per se, but they are facilitating their own economic way of doing things they are planning. So I say, okay, it's okay to buy you the vehicles, but is the timing right? You know, because is this the right time now? We think, what did you learn from the first phase that you can learn now? Is the timing right for you to now spend it on vehicles? Probably could actually, what should we say? It's things you can postpone, expenditures you can postpone for now.
But beyond the vote towards MPs, government continues to spend large sums of money to purchase a fleet of vehicles for its VIPs and highest paid civil servants at the expense of poor taxpayers. According to this year's financial budget, government doled out 714 billion shillings towards purchasing vehicles for public servants and politicians in the country. The costs consist of the following items: fuel, lubricants and oils, 257.4 billion shillings, vehicle maintenance, 110.6 billion shillings, and transport equipment, 346.5 billion shillings. Out of this total cost, Parliament, the Defence Ministry and Police got the lion's share. Parliament is to spend on transport equipment 116.4 billion shillings, on maintenance of vehicles 4.7 billion shillings, fuel, lubricants and oils 5.6 billion shillings, which makes a total vote of 127 billion shillings for Parliament. The Defence Ministry has an allocation of fuel, lubricants and oils worth 71.3 billion shillings, maintenance of vehicles 13.1 billion shillings, and transport and equipment 22.9 billion shillings, and other costs, which brings it to a total of 161.2 billion shillings. Uganda Police Force has been allocated on fuel, lubricants and oils 45.6 billion shillings, on maintenance of vehicles 16.3 billion shillings, making it a total of 62 billion shillings. The Office of the President has been allocated on fuel, lubricants and oils 2.1 billion shillings, on maintenance of vehicles 1.6 billion shillings, and on transport equipment 12.1 billion shillings, and other costs, bringing the total cost to 20.2 billion shillings. The Ministry of Health, which was allocated 1.5 trillion shillings, has allocated at least 10.9 billion shillings on cars. For example, on fuel, lubricants and oils, 4.3 billion shillings, on maintenance of vehicles, 1.2 billion shillings, and on transport and equipment, 5.4 billion shillings. State House doled out funds to vote such as community outreach programs and welfare activities, and its total budget stood at 21.9 billion shillings. According to records of the Auditor General's report of the financial year 2020, government spent nearly 118 billion shillings to purchase vehicles in the last 3 financial years. This excluded costs on fuel, lubricants and maintenance of the fleet. The report further reveals that about 130 government vehicles procured at a cost of 33.9 billion shillings had engine capacities higher than what was recommended. The purchase of a fleet with a higher engine capacity resulted into an increment in fuel and maintenance costs. Mwanga also revealed that out of the 61 sampled entities, 49, about 80.3%, did not have a specific policy or guidelines on motor vehicle management to guide the usage and to eliminate theft, losses, wastage and misuse of motor vehicles. The audit also revealed that 41 of the selected entities holding a total of 5,280 vehicles spent 125.7 billion shillings on vehicle maintenance and had an increase of 28% of the average total maintenance cost per vehicle over the 3-year period.
Why should people who are entitled to those huge benefits then be given free vehicles, free fuel?
In 2016, Kira Municipality MP Ibrahim Uganda tabled a motion to revise the policy of vehicle purchase of senior civil servants and politicians.
The motion was that we need to do away with the provision of vehicles to all government people, with the exception of the President, Vice President, Speaker, Chief Justice. The rest of the government people, we can give them loans recoverable from their allowances every month. And they should be the ones determining which vehicles they need. Because you can't buy, for example, you are a PS, say in Minister of Finance, you stay in Ntinda. You can come to town in a heap sum. I was in the Parliament of Seychelles. They cracked Parliament and the Speaker bypassed me in a room, a vehicle of just about 20 million shilling. 2 top parliamentary staff, the clerk and the Speaker, when they are going for lunch, in a heap sum. In Uganda here, it will be a convoy.
He later handed his proposal to the then Public Service Minister, Muruli Mukasa, which was later shelved.
They are responsible individuals. They should be responsible for their own transportation the same way every other person is responsible. So we treat this class of people as though they suddenly, from being, high school pass or drop out, some of them, suddenly we treat them almost as though they alone are holding up the country. They are not. And so by doing that, we actually take resources that should be going into real needs and we put them in the wrong places.
Usually, politicians and civil servants prefer to drive posh 4-wheel vehicles for a short span of time and then have them replaced with brand new cars. As a result, an abandoned fleet of vehicles lie in ruin across parking yards of ministries. Whereas government has an appetite to purchase vehicles for its most paid civil servants and politicians, it's less keen to buy ambulances and equip emergency rooms at government hospitals. According to a report by the Uganda Police, a total of 3,880 people perished in road accidents last year. But researchers say that many could have been saved if the country had a functional ambulance system and emergency services. A research into the state of emergency medical services in Uganda undertaken in 2018 foreshadowed a crisis that could cripple the health sector in the event of a global pandemic outbreak. Amongst the major findings, the research revealed that Uganda did not have a national policy on emergency medical services and no such policies existed at district level. For instance, ambulances, which are acutely short in supply almost universally, lack the most basic of equipment and medicines both to monitor and to treat emergency conditions. It was also discovered that advanced life support equipment within ambulances like vital signs monitor, electrocardiogram machines, defibrillator, and intubation were missing. So, where did we go wrong? Dr. John Baptist Nambohe, the Commissioner Emergency Services in the Ministry of Health, admits that the pandemic caught them unaware.
Did not think that there would be so much need for especially the ambulance component of the continent. And we had the only 20 ambulances prepared for the COVID-19 response across the country. Though originally we had the 178 ambulances all across, distributed throughout the country at district level, general hospital level, and some of them at the health center 4 level. Now these ambulances, the 178 ambulances, are not equipped with oxygen or with basic life-saving equipment. But what was again a problem therein is that our ambulance teams, the emergency care professionals in the ambulances, had not been trained for these highly infectious diseases.
Many low-income countries like Uganda lack a formalized emergency medical system. Consequently, an estimated 80% of deaths due to injuries occur before they get to a hospital. According to Nambohe, the country needs over 400 ambulances to be fully prepared for emergencies.
We did a plan, and we required in the whole country 460 ambulances in order to have coverage for the oncoming COVID-19 pandemic diseases. And 30 of them would be the basic life support, or what we call emergency ambulances, and the 30 of them would be the intensive care unit ambulances. We call them commonly as type C. So we started the process of procurement of this very, very important equipment, and at this point in time we all recognize that it is an urgent issue, because
when COVID-19 hit the country in March 2020, a number of well-wishers donated items, including food and money, worth 29.6 billion shillings to help with the pandemic response. However, government's obsession with vehicles reached its pinnacle when the Ministry of Health spent 23 billion shillings out of the total donations to buy double cabin pickups. Many criticized the government for procuring these vehicles at the time the country grappled with an acute shortage of ambulances. Dr. Namboya, however, says cars are an integral part of COVID-19 response.
You will get time and talk to the district health officers, and they tell you how they have suffered during the first and second wave in responding. Because when we are here in Kampala, we say, oh, please, there are reports that there are cases within your community. We receive from those alerts, the calls which people give, maybe my neighbor is this, maybe in my home is this, and you are telling the district surveillance officer that, please, can you respond to this alert? It is in village number this, number this, number this. Go to this place, there is a person like this was made. This is the phone number.
Dr. Nambohe adds that new rules and regulations on ambulances are in the offing.
The emergency medical services policy is towards the final end, and it is the one which will determine sometimes even the setting up the regulations, the statutory instruments will depend on that. It has been submitted to Cabinet Secretariat.
With the third wave looming, the country continues to heavily borrow and loans could surpass the 50% threshold of debt to GDP ratio. According to estimates, Uganda's debt will have surged past 70 trillion shillings by the end of the current financial year. However, as the country inches towards the fiscal cliff, most of the expenditure is geared towards the non-productive sectors of the economy, like the superfluous expenditure on vehicles and sustaining a bloated government structure.
This issue of expenditure, you know, expenditure is a very touchy issue, especially in case people are coming from somewhere. Where do you start touching to reduce expenditures when you're used to the way you do your business as usual? And definitely borrowing is okay. I will never condone borrowing if it's spent in the right way. And that's what I was emphasizing from the first point. If we had learned from our mistakes, then we could say let's borrow correctly and for the right reasons.
So what should we prioritize? According to Dr. Madina, investments in ICT, health and education sector could lift the economy out of gloom. Definitely,
Communication and technology has to be there because it's leading the revolution of change. And that cascades into health, cascades into education and the other basic services, such that even if you have these well-connected roads, the markets have to be emphasized, but these are essentials for doing business.
Look at health needs do Ugandans have? How can they be best met? And what is it going to take to put that in place in terms of the right policies, in terms of the financing? So once we can get the governance right and the financing right, all of these other things will come together. As long as we have a vulnerable population that does not have access to life-saving care, then our health services are only going to be good enough either for chronic conditions or for those that have enough money. And we don't have enough people that have enough money. We've seen it in the pandemic.
Spend and only spend on those items that will bring impact. For example, members of parliament vehicles, they have no impact at all, zero. Yet this money would have saved so many medium and small enterprises.
Have hit the economy severely and dimmed prospects for a quick recovery. According to an August Bank of Uganda monetary policy statement, the economic outlook is uncertain and will grow at a range of between 3.5% to 4% in financial year 2021-2022. The economy is expected to bounce back in financial year 2024-2025, where growth rates are projected at 6 to 7%. Economic experts postulate that fiscal discipline, austerity measures, and spending on priority sectors will offer the saving grace and heal the pain of millions of Ugandans whose lives have been upended by the pandemic. But that is the decision for the executive and policy wonks to make. Uganda's national income per capita stands at a paltry $800. Well, this is less than that of Yemen, a desert country in the Middle East that is under the clutches of an insurgency. The COVID-19 pandemic has also worsened the income divide between the rich and the poor and pushed thousands into abject poverty. Civil society actors say government must rethink its car policy if it's to meet the expectations of its most vulnerable.